This part of this week, we are spending some time here updating the guidelines for management of COVID-19. So issues covering around infection prevention and control, diagnosis of COVID-19, how to manage patients when they come into a facility, offering critical care management to patients with COVID-19. And we have a large team of experts in various areas, in infectious disease, we have pharmacists, we have critical care specialists, we have infection prevention specialists, really just coming together to update guidelines that will ensure that every patient who presents with features of COVID-19 is diagnosed in a timely manner and offered appropriate treatment. In terms of where we are, that's an interesting question because the answer changes from time to time. So as you're well aware, over the last several weeks, we've had a significant surge in the western part of the country that seems to be coming down a little now. But on the other side, we're now beginning to see a rise in cases in Nairobi and some of the surrounding areas. For example, in hospitals in Nairobi, we've seen an almost doubling of the number of cases over the last 2 or so weeks. So we are not, we are far from totally eliminating or totally controlling the disease. It's likely that over the next several months we'll see surges, periods when we have surges and periods when we have less of the disease. And really how this disease spreads will be very dependent on what we as a people do and how well we adhere to some of the containment measures that we've been told before. So if we look back over the last year or so of COVID globally, we have noticed that countries that had very intense political activity ended up with very large surges around that time. And I think one of the most recent examples would be the situation that was seen in India recently, where a very large surge was preceded by very intense political and other activities. I think one of the things that we notice about many of our political activities is that usually the whole concept of social distancing and avoiding public gatherings is really thrown out of the window. Is that, I mean, so far we know over about 1 million people have been vaccinated, and that some vaccines are expected into the country over the next month or two. And we've sort of received some assurance that probably before the end of this year, we'll have enough to vaccinate at least 10 million Kenyans or more. So this is the information that has been released from the Ministry of Health in its press releases. So it's unfortunate that bad news and myths spread so rapidly. I wish the good things we said spread as rapidly as the myths and, and the lies and all the rest. So one of the things, having had so many people vaccinated globally so far, we know that the vaccines are generally safe. We also know that they protect people from severe disease and from death.
And in this workshop that we are here today, Naivasha, WHO is supporting a very key workshop of experts that are looking at the revision of the national guidelines for management of patients with COVID-19. We know that the country now has recorded quite now we are at the fourth surge, or what we call a wave, that emerging since we started last year. And right now the country has over 100 and actually 70,000 cases so far recorded. With this, we see that the country has done quite well in trying to respond to the measures that the government has put in place with partners, with clinicians, and even with the community, especially the community, because the role of COVID prevention is really at a personal level. So I believe that the country has really responded as much as they could, but we are not out of the woods. This particular disease is unprecedented. Every time there's something new happening. For example, there are new variants now coming in with different kind of presentation, and how they react even for immunization, how they react to treatment. So this is ongoing data that comes out all the time, and that's why we have to update all the time the guidelines. The upsurge, well, that's quite a good question, but it's just not about Kenya only. We know that the upsurge of COVID-19 is actually globally. If you look at globally, the graph also goes up, down. Even we are at the third surge globally in terms of the COVID cases, meaning that why are we getting this upsurge, up, down, up, down? One of the things we see, again, as I said, is the reemerging of new variants. You see, when you get COVID-19 subtype, people will be infected to it and perhaps develop some form of immunity. But then a new one will come. It will mutate and show a different pattern. And again, the very people who were infected with the previous pattern will again be reinfected. So you get another surge. So really what this means is because of the multiple instability of this virus that we need therefore to have vaccination, as many as possible those who are at risk.